Hey, good morning. We're here at the University of Kansas Health System in our studio, and we're broadcasting live. We have a special guest this morning, Senator Jerry Moran. Before we turn to Senator Moran, I do want to explain something. We have on some pretty cool T-shirts, and I bet Senator Moran has his on too. Stay strong, Kansas City. Stay home. And what really the same message we keep giving you is right back, and it's live again today. The most important thing you can do, we're still in the middle of Passover, Easter's on Sunday. Shelter in place, stay home, stay safe. Remember, it's very possible that anywhere from 5 to 10% of people may have or have had the coronavirus active here in Kansas City and could spread it. You go to a gathering of let's say 50 people, there may be 5 or 10 of those folks who actually could pass it along or could pick it up at that gathering and take it outside of that. So it's so important to do this because there is some preliminary evidence that we are bending the curve, which will be to all of our benefits and allow us to get back to some more semblance of normal a little bit faster and certainly a lot safer. And so we really hope that people are going to shelter at home. And these T-shirts provided by Blue KC and many other partners are kind of a reminder of that. At the end of the show, we have a special presentation. There's a rap song called Go With The Flow. It is written and performed by Ethan and Charlie Gunn. Their mom, Jamie Gunn, is a pediatric ICU nurse here at KU. Hang on to the end because that is a cool rap song. I think you're going to enjoy it. So Dana, what are our numbers like today here at KU?
Yeah, overall today the inpatient numbers, we are at 30. We have a third of those, 10 in the ICU, and about 9 that are on the ventilator. So overall, the numbers seem to be about stable, but if you think about the discharges we've had, luckily, people going home, our inpatient numbers are creeping up a little bit. So this weekend is vitally crucial, whether it's a religious gathering or a secular gathering. It doesn't matter. It's still a gathering of people. That number could exponentially increase if we are not vigilant, if we are not staying away, social distancing, physical distancing.
Senator Moran, welcome to our show. Thank you so much for joining us this morning. Really appreciate that you took time to be with us. What important? Well, first of all, do you have your cool T-shirt on? And second of all, I bet you have an important message for us.
Dr. Stites, thank you. Dr. Hawkinson, thank you very much. Yes, it is T-shirt. Thank you to providing me a T-shirt, and we'll hang tough with Kansas City. I appreciate the efforts that are being made to have the whole community, in fact, the whole state, the whole region, come together to protect not only ourselves, our families, but to protect other people, our neighbors and people we don't know, and to give you and others at KU Health Systems and hospitals and physicians across the state and across the country the chance to do their job, to protect people, to help make them well, and to care for us. And we've talked about this before on many occasions about bending the curve. Yesterday I was on a phone call with Dr. Fauci. People will remember that he has lowered his estimates of deaths in the United States and is doing so based on the evidence that's beginning to show that distancing, social isolation, social distancing and isolation is beginning to take an effect, and the curve is beginning to bend. So we've been looking for two things. I think you all are the experts, but I keep paying attention to this number. Is isolation and social distancing working? And the answer appears to be yes. And will summer weather, will spring weather, warmer weather bring us a virus that is less likely to spread? And we're anxious to find out that information. But all of us need to do our part to make certain that we bend the curve. And those are just words that mean we're keeping people healthy and safe, and we're not spreading a dangerous virus. I do have a couple of things to talk about. PPP continues to be in front and center. This seems to be the business side of Congress's response to COVID-19. This is the small business loan program in which small businesses less than 500 employees can receive a loan, and if they keep their employees working, even though they may not be working on site at the business in the factory, they can have that loan forgiven. Across the country, 522,000 loans have been approved for about $134 billion, a program that has received lots of attention in Kansas. and had a few glitches to begin with, but is certainly working on behalf of keeping business in business. But the side effect of that is encouraging businesses to keep their employees employed, even if they can't be at the work site. So it has a health consequence as well. Testing and PPE remain a top priority for me. I'm of the view that when medical professionals tell me that they are testing people according to CDC guidelines, those guidelines are based upon a shortage of tests. And we are working, again, conversations yesterday with FDA, earlier in the week with CDC. We are trying to get the testing protocols and, more importantly, the testing availability spread widely across the country so we can know more about ourselves, we can know more about the situation in our community, and we can more quickly return to a more and more normal life with people returning to work once the evidence shows that either we're immune or the virus doesn't exist in our community or in us. PPE, the personal protective equipment, remains really a huge issue for us. We have done everything I can do to get the equipment out of the federal storage. I'm told that everything that the federal government has in storage has been moved to the states, including Kansas. And every day that goes by, we're working with manufacturers and others to get them the FDA approval to put gowns and masks and gloves into the hands of those who need it. Not only those at KU Health System, but our emergency preparedness folks, the people who work in a nursing home and assisted living. There's great demand here for this, and we were not prepared as a country, and we have a lot of catch-up to do.
Well,
Excuse me, a huge issue. I'm sorry, Doctor.
No, please, go ahead.
Front and center in this PPP program, this small business loan program, is for hospitals across Kansas and across the country. If they are a political subdivision, they don't qualify, and we're working hard to get that fixed. Many hospitals in Kansas are a county hospital, a city hospital, or a district hospital, and we're looking for a solution so they too can receive the loan just like a not-for-profit hospital or another business in the community. And the doctor says, I have an announcement to make. Today is the day that the first segment of the $100 billion. So the CARES Act that created the programs I've been talking about created a fund to help healthcare providers meet the needs, because what we see is hospitals and other healthcare providers across Kansas, around the country, their revenues are down significantly and their costs are up significantly. Most hospitals in Kansas are at the narrowest of profit margins. Some operate in the negative, some just barely in the positive. In today's, imagine there's a hospital in Kansas that is operating in anything but the red. And this $100 billion, the distribution begins today. Kansas hospitals are beginning to receive that money. I've already had one call from a hospital. We're working with the Kansas Hospital Association to make certain we get the best information from a community hospital in central Kansas. That was $417,000. That is a significant benefit, not just to that hospital, keeping it in business, but to the community and the patients that they serve. And yesterday, in conversations with University of Kansas Health Systems, they are expecting a significant amount of money from this fund arriving today, which again keeps them in the position in which they can help all of us stay healthy and meet the needs as this crisis continues to develop. So the announcement is that money is arriving, and we'll be hearing from hospitals across Kansas throughout the day. And it seems to me that Health and Human Services is doing this in a way that allows the money to be distributed quickly. It is based upon the Medicare reimbursement that hospital receives. And in addition to that, hospitals can receive they can receive between 3 and 6 months of their Medicare payments. This is outside the money arriving today. They can receive 3 to 6 months of their Medicare reimbursement, the last 3 to 6 months, in advance for next 3 to 6 months. And already $52 billion has been distributed, advancing that money to hospitals and other healthcare providers across Kansas and the country. So the CARES Act has some benefits, certainly some flaws as well, but we're trying to get the tools to the people like I'm on the phone with today, Dr. Hawkinson and Dr. Stites, so they can do the tremendous work, they and their colleagues, that are necessary in this time of COVID-19. I appreciate this to be with you, and I look forward to responding to any questions.
And Senator Moran, just to say thank you so much for your great leadership, and you have worked tirelessly on this issue. We had a conversation with you, I think, gosh, three weeks ago now, in which we emphasized the impact on hospitals, and I do want to say a special shout out and thank you to you and your team's efforts for working so hard on this, because I do think it's a great benefit and helping all of Kansas and really our region take care of patients met by this crisis, and remembering that we have a lot of patients who don't have COVID that we still have to take care of. And I think all hospitals have had a significant drop in revenue, and yet they are the focal point of trying to take care of folks. And I think the combination of efforts to take care of healthcare folks and the efforts to try and keep our economy going are going to be something that will be long remembered. So thank you for your great efforts on that. We are open.
You're very welcome. When you all can do your jobs, then we all can get back to something much more normal. We all none of us want to be told what we can't do. We want to get back to work.
Yes. So questions that are out there for the senator, for anybody here in the studio.
Hi, this is Brian Lowry from the Kansas City Star. I've got a question for the senator, but I'd also throw it out there to the medical personnel on the call. I've talked to a number of manufacturers who are trying to get material out there, medical equipment, PPE. This is not what they typically make, but they have the capacity. They're running into various headaches. But one thing I wanted to ask on the other side of that coin is, as we are asking the FDA to kind of ease the process, how are we ensuring the equipment that these non-medical manufacturers make meets the standards that we have in the U.S.? And Senator, if you have any thoughts on that, and if any of the doctors on the call have any thoughts on that, I'd be very appreciative.
Senator?
Brian, I would welcome the expertise of the medical professionals, but when we are asking the FDA to do more to speed up the process, the efforts are designed at eliminating the bureaucracy, the paperwork, and just the tedious nature of the way that government normally operates, without reducing the standards for which that equipment must comply. So it is putting the necessary resources. The CARES Act and other actions by Congress has increased the funding for the Food and Drug Administration dramatically. And so it in some ways becomes more resources, but also an attitude of focusing many, if not most, of the resources at FDA on this particular issue. For example, I'm trying to help a non-COVID-19 issue at FDA for a Kansas company, but all the resources that I'm trying to get focused on that problem, I'm told, are focused on COVID-19 and the things that I am trying to get FDA to do in that regard. I would say, in addition to the equipment, Brian, getting that approval, it's also FDA's work at ports across our country, making certain that what is being imported to the United States still meets the criteria, still works. And we've seen significant examples in which materials coming from China and elsewhere don't meet those standards and are rejected. That is the right answer. We don't want something that doesn't work, but it is making sure that there is no delay in reaching those decisions.
We do want to make sure that the equipment we have is reliable, because the worst thing we can do, Dane, is give an unreliable answer. Talk to us what we just learned about the IgM and IgG tests to look at serology. There's that, let's use convalescent serum, but you have to figure out who's convalescent and who's not.
So exactly what the senator was talking about. There are a lot of companies out there producing these new tests or producing these products for one reason or another. Some are very good and altruistic and want to help. However, we do need to evaluate the safety and efficacy. We need to make sure that these tests are validated. We need to make sure that when we get the result, it's the correct result. That it's, if you have a negative result, that it's truly negative, and if you have a positive result, it's truly positive. And so this is going on in all aspects of healthcare, whether it's production of PPE, production of drugs or therapeutics, or production of testing tests, as well as testing supplies. It is all very important. We need to have standards. We need to continue to have and look for the safety and the efficacy of all these things.
And we learned that all those tests that are looking at serum for IgM and IgG levels for coronavirus turned out to actually, they do measure any coronavirus, not just the one that causes COVID-19.
That is one of the concerns. They could tell you that you had SARS-CoV-2 when in fact you may have had exposure to just one of the normal 4 coronaviruses that cause a simple common cough and cold.
I do know, just to say, as we focused a lot on PPE, but the pharmacology supplies for ventilator patients and for operations are really in short supply, and that may be the next big thing that we hit. And I think we're going to need to focus on pharmacotherapeutics, if that's a big word. We're going to focus on drug production, because that's going to be the thing that I think is going to snag us, even as PPE supplies begin to ramp up. Next question. Well, not hearing any. I'll have one.
Sorry. Question for Dana. Dr. Stites referenced the 5 people out of 50 potentially carrying the virus right now. Mm-hmm. When you think about essentially 10% of the population out there, in epidemiological terms, what does that imply for the depth of exposure across the entire population? Are we? Have we reached a point where a lot more people have been exposed and sort of rejected or already processed this?
Yeah, so my data is more of a United States data. The Kansas City data is probably a little less than that, but Dan, you want to pick that up?
I think overall we are still on the upswing or on the ascent of the local or regional population as far as coming into contact with the virus, getting ill from the virus. So I think epidemiologically we are still on the ascent. And again, I think that's why it's so vitally important. This weekend is very crucial because we do want to get together with friends. We do want to get together with family. We want to celebrate this great holiday. But we have to do it in a very smart manner with social distancing, not gathering, because it could exponentially spread from the somewhat low amounts that we think are prevalent in the community now to extremely high amounts, and that's what we don't want. So that is why these next 10 days to 2 weeks are going to be so crucial in knowing where we stand in the infection prevalence and the critically ill patients as well.
Yes.
Dr. Stites, to the population there at the hospital that's been admitted, can you say anything about how the age breakdown of those patients is? Are we following what you've seen elsewhere in the country with the elder people being most prevalent?
Absolutely. It looks just like the thing. There was an article that, or some information the CDC went out with yesterday about looking at 1,400 patients who had passed away in the United States and kind of what their breakdown. And ours is almost right out of that book. So I don't think we're seeing anything different than what folks across the country are seeing, which isn't a surprise because the story's been the same in China, then Italy, then France, Germany, Spain, then the United States. It's the same in New York City. We are seeing younger patients, perhaps, and may have been reported, not us, but the United States in general. We're seeing that coming out of New York. A reminder that young people can get sick. And even though we say that you're most at risk if you have other underlying health problems, but that can include simple things like high blood pressure and of course, diabetes and heart failure and obstructive lung disease and emphysema and asthma, cancer, et cetera. Even those things make it more likely. We have young people, and we've had some young people in the ICU on the ventilator who aren't doing particularly well. And so just remember, it can get anybody. And one of the reasons to make sure that you avoid social gatherings of 6 or more or trying to shelter in place is so that you don't spread it. The other problem is that because kids are asymptomatic carriers so frequently, that's one of the biggest things that I think has happened. With the closure of schools and the closure of places where children can congregate, it's really helped, I believe, in the transmission and helped us bend the curve. And so, I'm optimistic that we're bending the curve, but I don't want to be so optimistic we go out and do stuff because we won't be bending. We'll bend the curve again, but we're going to bend it in the wrong direction. And that's really important. I just can't say that enough. So, Senator, are you taking care of yourself? Are you even at all able to shelter in place with all the business of the Senate?
I've been relegated to the basement for about 14 days. This is my actually 14th day of basement. I get out once a day and put in my cardio in a very isolated place and then back. And I spend most of my day on the phone, on the email, and trying to solve problems that, while I talked about some of the benefits of legislation and congressional efforts, we've also created some problems, and there's lots of things that slip through the cracks and things that need to be corrected. And so I am isolated and trying to make certain that I do my part in contributing to slowing the spread of this virus protecting me and my family, but also taking care of the neighbors in the neighborhood.
You bet. Are you in the basement in Kansas, or do you have to still be in D.C.?
I'm in the basement in Kansas.
All right. So
yes, I
your
would
wife,
prefer
I know your wife because she went to college with me. She was much smarter than I was and much nicer. I was kind of dorky, but she's again showing her smarts by making sure you're staying in the basement.
Well, I hope the reason I'm staying in the basement, because she has insisted, you're right, Doctor. She's insisted I stay in the basement. I hope it's related to COVID-19 and nothing else. We have a daughter who is a veterinarian who is essential, and she's at work, and she has a new 3-month-old and our first grandchild, and so my wife has become the daycare provider, the grandma at work, and so all the more reason that we and others need to be very cautious.
Other questions out there? And congratulations on being a grandparent.
Thank you.
This is Nate with the health system. I have a couple of questions. One person would like to know if after we get a vaccine for COVID-19 and the crisis is over, are there specific plans being made so our state and country will never be unprepared again? And then just another one that's a little bit different that you might be able to respond to is the COVID-19 disease rate is dramatically higher in Wyandotte County than any other place in Kansas. Is that a concern?
Senator, do you want to try the first, and then I want to frame that second part of that question, because we had a great session yesterday and talked about health disparities. But what's your sense about preparedness nationally for the next time a next pandemic comes along?
It is important that we are in a different position than we were upon the arrival or knowledge of COVID-19. The country, I think it's natural. Americans, we think of ourselves as generally immune to many of the problems of the world, and that a virus, a pandemic, would not affect us like it would other places that we would describe as third world countries. And so we have this suggestion to ourselves that we're above this kind of circumstance. Obviously, we are not. And so that kind of attitude that it could never affect us needs to disappear, and I assume the facts would suggest that we're all reaching that conclusion. I also would say, as a Kansan, we generally have the attitude that things that happen on the coast happen to us. And again, what we discovered is, while the hot spots are not in our region yet, we are not immune from this. And so, as Americans, we can't say we're isolated from this kind of crisis in the world, and as Kansans, we can't say it'll never happen here in the Midwest. Dr. Robert Redfield is the director of the CDC. He and I are well acquainted, and we had a telephone conversation the last couple of days. We were talking about the future, and his point to me is that as a member of the Senate interested in public health, I got to say where I was. I was always kind of thinking in this last few months that as soon as this is behind us, then we need to focus on how to prevent this happening from in this country again, or in this world again, with what we do in the United States Senate. His point to me, which I think is valid and has caught my attention, is don't wait. Don't wait till you think this is over. In phase 4, assuming that there is a phase 4 in congressional action, so this last act, CARES Act, was phase 3. We're already debating what should be in another legislative package. Do not wait to get us in a position of being able to better meet this crisis, but the next one as well, this next healthcare crisis. And the points there are, certainly we need to try to help other countries in their ability to fight viruses, to fight infections, and we can't say, well, that's a problem for some other country. Yes, absolutely want them to do their part, but many don't have the resources to do anything, and what happens there affects us. So it has an international component, but what we're talking about in addition is the supply chain. I'm amazed, disappointed that we rely so heavily on other countries to meet our healthcare needs, in pharmaceuticals to gowns and gloves. How we manufacture things is a component of how we address this, because timeliness obviously matters and closer to home, far away.
Well, and I think,
Vaccines and testing.
yes.
Those things need to be addressed now. And so there's a significant component, in my view, of getting us in a better place to be, so the doctors that I have the privilege of being with have an easier fighting chance to help Americans avoid the next pandemic, and our efforts need to begin today, not tomorrow, not when things get back to normal.
And one of the things we see, I think, is that countries they're going to take care of their own folks, and that's not a big surprise, but that doesn't mean they necessarily want to ship things to the United States, even at a time of great crisis. So, Senator, from the standpoint of the question of racial disparities, or ethnic or any other type of economic disparities and how that affects COVID-19, we know, we from that loud and clear yesterday in our session, because we know, for example, that Wyandotte County, which has about less than half the population of Johnson County, is rapidly rising in its number of cases and will probably meet or surpass Johnson County. Yet the CDC not always put that data out there. How do we look at that going forward, and what's your sense of how we should take on some of those questions?
I'm surprised you're addressing this question to me. I would leave this to the infectious disease experts. I would say, as a public policy matter, information matters. Our ability to make the right choices and not just to throw money at a problem is determined by what information we have. And that's where the expertise of you and others, where the CDC, the FDA, and the NIH, the National Institute of Health, where their expertise is important for me and my colleagues as public policy makers. We need that information so that we can focus the resources in the best direction. Government often has the habit of just throwing money at something. The legislation that we've been talking about, or I've been talking about this morning, it spends way more money than I ever thought I would be comfortable voting for. Government intrudes into personal and family lives in ways that I would have never thought satisfactory, all because we have this great challenge now. We need to get ourselves in a position in which we, in the future, have to ask people to stay home. I don't know if we can get there, but the goal is to get this, the information necessary to make public policy decisions that protect Americans and Kansans.
Dana, that makes a good point. What is the story here in Wyandotte, and to help answer that question that came up about disparity?
Yeah, I think all of that is true. I echo all of that, especially what Dr. Lisbon was talking about yesterday. You know, Magic Johnson was on TV last night and he was interviewed, and he said the same exact thing. Information matters. You know, this virus does not spare color. It doesn't spare blood type. It occurs in everyone and can occur in everyone. And I think if we continue to get out the message, if we can continue to address these other overall health disparities, not just COVID health disparities, but overall chronic illness health disparities, and there are many aspects to that, we need to continue to do that. We need to try and do that more. Certainly there are the socioeconomic situations and issues there, and there's access to health care, and there is other types of social issues, such as being constrained in multifamily areas and having a lot of people around, just as Dr. Lisbon was talking about yesterday. And we need to continue to address those as a city, as a county, as a state, and even nationally. And I think this exemplifies that even more as we see the number of cases of minorities compared to non-minorities in certain areas where minorities make up 10 to 20% of the population.
Yeah, we saw in some data. I'm sorry, go ahead.
Doctor, I just want to say one of the things that when you say kind of describing the demographics and no one's immune, one of the things that we need to invest in is our public health infrastructure, meaning community health centers and county health departments. They have not received the attention that they deserve, and the people who are working there have a huge role in our ability to control this circumstance. And so as we look to the future, not only to the present, but to the future, we can't forget our county health departments and the community health centers that serve communities across Kansas, regardless of the demographics.
I totally agree, and that is something that will make all of us stronger and healthier in the long run and able to handle the next big thing. sometimes we're challenged by the fact we think it's not going to come. It's been 100 years since the influenza pandemic, and now we have the coronavirus pandemic. And in that 100 years, unfortunately, we're not a lot stronger this time around than we were the last time. And hopefully, we'll from a public health standpoint and a healthcare standpoint, the more we can do to support that, the healthier everybody is, and the more they can get back to work. Next question.
For the doctors, we heard a lot of talk about the time track for developing a vaccine. Is it more important to prioritize that, or to prioritize any kind of testing that can help us establish how rampant this has been through the population? If a lot of people are capable of going back to work without infecting others, shouldn't we know that first?
Yeah, that's a great question. But just to say, to be really honest, I'm going to turn to Dana, but I want to preface it with this. You can't possibly know if a vaccine has worked unless you have enough testing to tell. Otherwise, just giving shots, you have no idea what happened.
Yeah.
You have to be able to test, Dana.
Yeah, absolutely. The testing and the vaccine, they're all part of the same big ball of this COVID-19 infection. And we need to be able with it. And I think, there are resources, there are different people, there's different monies going to each. I think we need to do both, and I don't think one is necessarily more important than the other.
Yeah, and I would agree with that. And there's not an easy, somebody would say, well, it's either or. It is absolutely not either or. If those two questions are wrapped together, you can't tell if therapy is effective, you can't tell if vaccination is effective, you can't tell if anything's effective unless you can test effectively and test a large, broad group of the population. The truth is, at some point, we're going to be in a post-COVID surge environment. And once we move from where we are today to a post-COVID surge, there's still COVID out there. Until a vaccine's developed or until there's therapy available, then there will still be a low level, we hope a low level, of COVID positive patients. And what we have to do is prevent minor outbreaks or smaller outbreaks becoming major outbreaks and making everybody go back into shelter in place and stay at home and social isolation and job loss and all those other things. The only way to do that is to have effective vaccines so you can track people, and then if you find someone who's positive, you can go get to all their contacts and try and make sure that those people are isolated. But that all is predicated on widespread, available, and rapid testing. So I will continue to beat that drum. Testing is incredibly important from a public health perspective. Next question.
If I could add to that, I want to weigh in on the value. I understand you're helping me understand the value of the understanding of how these two things go together, testing and vaccines. That's helpful to me. But our country, the things that I've been describing, the amount of money that's being spent, the economic consequence of what we have to do today, our country cannot have that occur over a prolonged period of time. Our economy and people cannot tolerate the circumstance of an economy that doesn't function. And getting tests broadly spread today helps us get to the point in which we can make decisions about the ability to re-enter the community and re-engage in our economic activities and again, get us back to a point in which we are capable of restoring people's ability to go to work, people's ability to gather together. This can't be an indefinite circumstance, and the way that I see getting us out of the nature of the circumstance we're in isolation is testing broadly available for anybody who wants to demonstrate who has the immunity. There's different kinds of tests. Determining immunity is one of them. It will help us get to a point where Americans and Kansans want to be faster if we had testing. And vaccines, in my conversation with Dr. Fauci yesterday, vaccines are months away before trials start. So it's nothing that's just around the corner. In the meantime, as we work on both, let me say it that way, testing becomes even much more important. And I'm thinking that come August, as we begin the conversation about returning to school, colleges opening their campus gates, and our K-12 educational institutions being able to accept students, I sure hope we're in a position to be able to test broadly. Leave it to the doctors to criticize or critique anything I said.
Senator, I think
you're the experts, but we got to get there.
You're dead on right. In fact, you can imagine saying, okay, KU, you're coming back into school. the first time a student has a fever, you're going to have to worry. Do they have a common cold, Dana, or do they have coronavirus? The only way to know that is to test them, because if you test them, you got to do a different thing than if they don't, if they're not positive. And so I can't emphasize enough. Kansas, we are, and in Western Missouri, our region, we have every reason to believe that we have all the advantages to do really not well. Nobody's doing well in the coronavirus, but to recover sooner and faster because we're just less dense. Not every street corner is full of people where you're running into each other. I mean, that's a real advantage when you're trying to think, how am I going to get past this and how can I get back to a more normal life? But in order to do that, we have to have the ability to test folks. So if someone has a fever or someone gets sick, we can know right away whether they have coronavirus. Because if they don't, let them go back to work. But if they do, I mean, the novel coronavirus, but if they, actually, don't go right back to work if you're sick. My bad on that. but well, that's good. He's a doctor giving us that advice. But no, but the point is still the same one. If you don't have the novel coronavirus, you don't have SARS-CoV-2, you are in a different position than if you have one of the other things, and that's just that just means we have to be able to test people as much and as rapidly as possible.
Without tests, I don't know who we're going to believe. I mean, I'm going to believe the professionals, people like you, but if we're in the same circumstance we are days down the road, months down the road, later this year, when are we? Even if the word is go back. Americans, many are anxious to go and want to go perhaps before it's appropriate. Others will be reluctant to go at all because they're uncertain as to whether it's safe. And in my view, that testing, broad testing, available testing, is the key to give us the satisfaction, the level of comfort that it's safe to return to, again, more normal life.
Yes.
Yeah.
No politician is going to be able to tell people, go to work. There's people who want to go to work despite the admonition not to today, and there's going to be people who will not enter the economy in the future because they're uncertain. We have to believe science and medicine, and that in.
Yep. Yeah. I think we have time for one more question.
I had somebody who's asked a question that she, there's actually a couple really good. One, she has asthma, and she wants to know if this is a death sentence with COVID-19 because she still has a job, is actively working. Is she putting herself in danger? And I guess somebody else had a question regarding the swab or regarding tests, wanting to know if they'd ever become simpler or will the long swabs always be required?
I'll take the asthma one. You take the swab question because those things hurt. So the answer to the asthma is I don't know what the job is, and that makes a big difference. I wouldn't say that it's a death sentence. There are a lot of things that factor into how you respond. How bad's the asthma? What's the level of control that you have of your asthma on a daily basis? You have to use your inhaler a lot. The more help you need on a daily basis to maintain your health from medications or other things, the more at risk you are from COVID-19. That's, I think, a simple but fairly true rule. The more serious your disease, the harder it's going to be. On the other hand, if you're pretty mild and your job doesn't require a lot of exposure to others, then you're probably relatively safe as long as you do all the other good things. Maintain distance of 6 feet, wash your hands for 20 seconds, do it right, don't touch your face, and cough into your elbow. And if you CDC recommended this week, wear a mask. So I think those were all the important things. Regarding the ability to test something else like saliva, Dana, where are we?
Oh, that's a great question. Yeah, so the testing is really bad. It's painful. It's painful for the person doing the test. It's painful if you're getting the test. The swab is about this long, and it has to go back almost to your ear, if you can imagine that.
Yeah, it's a brain biopsy.
It's a brain biopsy. We've said that before. So yeah, Dr. Stites is absolutely right. We are working on other methods to test, simpler methods, more rapid methods. The saliva test is one of the ones that we're looking at. It still hasn't been validated. It's still certainly not the gold standard. But if we can do that in a more non-invasive method, we would like to do that. If we can get more of a rapid turnaround time or diagnosis, that's going to help everybody from anybody on the street to especially our first responders, our police officers, our fire departments, our EMTs, to everybody who's working in essential, the mailman, the people who we're buying our groceries from. That's going to help everybody. And so if we can get to do that, we absolutely would like to do that. Those tests are being studied right now and validated so that we know they're accurate again, so we know if you have the disease, that you truly have the result, and if you don't, then you don't have the result. And that is what we're working on right now, absolutely.
Senator, as we wrap up today, any parting thoughts?
Well, I appreciate being educated as I listen to the two of you, and I appreciate all the folks at KU Health System in their efforts in this regard. But I would also to all of our other healthcare providers across the region who I know have anxiety, concern about themselves and their own families. We appreciate, Kansans appreciate, Americans appreciate people who are coming to work to make certain that we do everything we can for our health, for other people's health. And I'll just express gratitude to you, not only in hospitals, but our emergency preparedness folks, the people who are in the ambulance, our assisted living and senior care folks. We're trying to pay, I am paying more attention to the issues of nursing home and assisted living, senior companion care. We need those folks to be healthy. We need the people who work there to be healthy. If we fail to do that, the ability to care for those people in the hospital setting, if in huge influx becomes even a greater challenge for us. So my gratitude to all those who are working on behalf of others. While I've been still on the call, we've gotten reports from a few more hospitals across Kansas, and the amount of money that is coming their way is certainly an amount that can make a difference in their ability to meet the healthcare needs of the communities that they serve. So pieces of good news are beginning to flow in from across our state as far as financial resources to help keep hospital doors open and physicians in our communities. Thanks.
Well, no, thank you, Senator. And just to say, one of the things that is remarkable, I think, on our campus and hospitals everywhere in our city is to watch people pulling together to help beat COVID. And one of the things you can do this weekend, and again, I know it's Easter weekend, I know it's Passover, but just like our T-shirts say, stay strong, stay safe, stay home. Bending the curve makes all the difference. And watching people work together, watching our teams work together is rewarding. And Senator, just a special shout out again to you. The spirit of bipartisanship, I think, has made this whole battle a lot easier. And we say thank you. And thank you to your leadership and helping support Kansans, helping support hospitals. And I know that some of the things you've done are pivotal. You're a humble man. You won't say it. I will. Your leadership has been pivotal in trying to make sure that the healthcare industry got some support, as you said, to help keep our doors open. So to all of our listeners and audience out there, remember, the best way to beat Corona is with your help. What you do will make the difference. That's what's going to help us get back to a more normal life. Stay safe, stay home, stay strong. As we finish up today's show, remember we have a cool rap song, special one, Go With The Flow, written and performed by Ethan and Charlie Gunn, and their mom, Jamie, ICU nurse here at the University of Kansas Health System. Thank you all so much.
Hey. Yo, this is HG. Hey. I'll go with a flow. Quarantine can my fun. Nah, go with a flow. Quarantine can't stop my fun. Nah, wash your hands. Wash your hands. Now wash your hands. Quarantine, social distancing. Now 6 feet. When are we gonna party like 6 feet? 6 feet. Social distancing. Quarantine. Yeah, go with a flow. Quarantine can't stop my fun. Nah, go with a flow. Quarantine can't stop my fun. Nah, go with a flow. Quarantine can't stop my fun. Nah, go with a flow. Quarantine can't stop my fun. Nah.
Studio is clear.